Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been practicing cosmetic or aesthetic plastic surgery in the Scottsdale Paradise Valley area since 1992, and all I perform is aesthetic or cosmetic surgery. I have developed over the last couple of years, after many years of observation, really thinking about this extensively, and trying to figure out how do I address patients that may not be ready psychologically, financially, or downtime for a full facelift, but still I can deliver outstanding results. So I came up with the GenXLift, and that is a trademark procedure that I own. A GenXLift is different than a traditional facelift in many ways. It's a staged procedure that generally addresses the continuum of aging between early 30s and early 50s. So for purposes of answering the difference between a GenXLift and a traditional facelift, I'll talk about the more advanced stage of a GenXLift. So for patients that have more significant signs of facial aging, that is loss of volume, changes in their skin tone, discoloration of their skin, and actually jowl or early neck laxity, a GenXLift will address all of those things with certain advantages over a traditional facelift. In a GenXLift, I actually combine the 4-day laser peel along with fat transfer and a short scar facelift. So a short scar facelift is not just a cheek lift or a mini facelift. It actually involves elevating the deep tissues of the face to give you that more youthful volume back to where it used to be. So I'm able to perform that through abbreviated scars. So a traditional facelift is going to have scars in the sideburn, along the inside of the ear, and along the back following the hairline. A short scar facelift will have less scars, so it's generally at the sideburn, inside the ear, down to the earlobe. Since it's such a powerful procedure, elevating those deep tissues, I really don't have to go behind the ear unless there's a lot of aging in the neck. So there are other ways of addressing those age problems in the neck as long as they're not that significant. So a short scar facelift has less recovery because there are less incisions. It involves a more focused elevation of the deep tissues of the face, that is along the cheek area and jowl area and jawline, to bring them up to a more youthful position. Hence, it has the advantage of less downtime, less scarring, and it tends to be more affordable. Also, since you're doing a short scar facelift, it's not really a full facelift, so people find that more palatable and more acceptable in their minds that they haven't had the real thing yet, so you can always have that later. The other beauty is that it tends to be a little bit more affordable than a traditional facelift without sacrificing the results. The best way to figure out which kind of facelift is the best for you is to come in for a consultation. So what would you do? You bring in some old photographs. You have in your mind exactly what's bothering you. We'll sit down with a mirror and figure out what the best therapy or treatment is for you without cutting corners. So there are many advantages of the GenXLift. The other advantage is that it would be tailored just for you. So it's not just a cookie-cutter response to your facial aging. There's a stage response or a stage therapy that will address exactly what's bothering you. So the best way to figure out is come in for consultation. Thank you.